Head, Department of Community Medicine. With equal pleasure, I humbly request Dr. S.V. Madhu, Member ICMR.
Right enough, sir, for you to look after. You worry about your country, you don't worry about India. We will take care of our people, I said. So that's the kind of excitement which it created. 87 newspapers wrote about it. So you can imagine the kind of interest that it created. So the investigator for Jammu, the principal investigator was Dr. Rajiv Kumar Gupta, and Dr. Suman Kotwal was the co-PI. He is also here, and of course we had all the co-investigators. So I'm just going to show you two more slides about the in-depth study. So we've completed all the states, all the union territories in national capital of region of NCR of Delhi, all the union territories. After the study was completed, we found that J&K had been left out, J&K and Ladakh had been left out, and also the islands had been left out. The Andaman, Nicobar, that also has been completed now. So there's no part of India which is left out, and 121,000 people. Now, if you want to just I'm giving you the overall India figures. So if you look at the overall India, 16% of urban India has diabetes and about 9% of rural India has diabetes. Overall it's 11%. So 11% of all adults above 20 years of age in India have diabetes. That's how you get this 101 million people. And this is just a graph to show you. Red means above 10% prevalence of diabetes. And you can see, if you see urban area, everything is red. Luckily in rural areas we still have some green, but if we don't watch out, all those greens will become red very soon, and it's our job to prevent that from happening. Where does all that fat go? It's going first into the liver only. So,
metformin and diabetes, they are two sides of the same coin.
Same coin. Yeah. So, when you talk metabolic syndrome,
You're
we
right.
presented metabolic. What is metabolic syndrome? There's fat everywhere with the thing, and so fatty liver is now included in metabolic syndrome. So
I would like to mention it.
Always remembered you, and he was your teacher also, sir, and you are my teacher. Dignitaries and the dice, sir, it's wonderful occasion to unveil the data, sir. In our country, what we lack is not the number of patients, the number of experts. Money, you told, there's no dearth of money, but only there is deficiency of data, authentic data. And many times the data which we present is not honored because it is not properly collected actually. And now the things are changing actually. And as you told, this data about diabetes, I've been told that the total number of diabetics in the country are more than the population of Brazil. And you told correctly that we have our own set of problems to take care. I am an oncologist, sir, and similar problems I am facing about the data. And recently in 2014, we started a hospital-based cancer registry with the help of ICMR, which is running wonderfully well.
Of Jammu region findings. So myself and Dr. Suman Kotwal, who is today busy in his family marriage in native place in Bhadrava, so he could not be here. The objectives of the study remain as said earlier by Mohan sir, that prevalence of diabetes mellitus, then IGT and IFG, and to compare prevalence of T2DM in urban and rural areas, and besides other things like hypertension, CAD, and level of diabetes control among the population.